average is running, and then that helps in turn kind of show them what your real life numbers might look like, and not always the ones that might be just a little bit elevated because of traffic and parking and running behind on your appointments. You kind of want a collection of numbers that they can draw an average off of. So ideally, we want people to run an average below 130 over 85 or so. The 130 meaning sort of the upper number is the pressure in your arteries when you're measuring it, when your heart is contracting blood into your blood vessel system. And the lower number is the pressure in your arteries in between the heartbeats. So that's why it's called systolic for the upper number, which is when your heart's squeezing, and diastolic for the lower number, which is in between the beats when it's not squeezing. There's a number of different agents that we can expect that people's blood pressures may be running higher because of. And it's good to know some of these things because maybe it can help us manage our own blood pressure. You hear about how salt can be bad for people and how much comes into our diet, but salt and its higher intake in the North American type of diet is known to eventually cause problems by creating high blood pressure over our lifetime. So the lower the salt diet we consume, the better our risk and the lower our blood pressures. Salt comes in big quantities when we eat out. The more we eat at home and prepare our own meals, the less there is. You might put like a little sugar cube worth of salt into the pot of whatever you're making, but that's usually divided into like all the people in your household and you eat it in leftovers. But that entire sort of amount of salt might come in a single portion size from a restaurant meal. So it adds up really fast when it comes to especially restaurant food that uses salt as kind of more of a preservative. Caffeine in excess, in not everybody, but in some people, can also contribute to sort of higher blood pressure readings or faster heart rates because it's a bit of a stimulant. Decongestants, it'll usually like be on medicine labeling when you're going to get something for allergies or cold remedies that some of the ingredients in them can raise blood pressure. Know that all the pain medicines that we use for anti-inflammatories like ibuprofen, Aleve, Motrin, Advil, diclofenac, Voltaren, Celebrex for all our bad joints, the more regular we use them, it will raise our blood pressure. So we really like to try to minimize its use. Of course, it plays a role in hurting less, but Tylenol is probably like a better agent. But it's good to know why our blood pressure might be running a little bit higher because we're using some of these items. Pain itself will raise blood pressure. Stress, of course, even some of these like steroids that you might get as a shot in a joint or a rapid taper because we have some asthma or inflammatory illness, those can also temporarily raise blood pressure. Another risk factor is high cholesterol. Again, another one that we can't feel unless somebody takes our blood and measures it. A lot of our risk factors aren't things we know we have unless somebody actually is looking and measuring. So we can't feel cholesterol when it's elevated in our bloodstream, but our blood test will tell that to us. And if you're going for annual physical exams, it's always good to make sure your doctor is checking that. You hear about how there's different pieces of cholesterol. When you do a lab, you'll learn about what the LDL or the HDL or the triglyceride is. You hear that good cholesterol is called HDL. I think about the H as being what you want to be nice and high. And LDL is a bad cholesterol that contributes to growth inside our arteries, as if you're kind of gumming up our circulation by growing cholesterol and plaque inside. Plaque is just a word that means something that's stuck up on a wall. If you have like a plaque in your office, it's probably your degree. If you have plaque on your teeth, it just means there's bacteria like stuck to your teeth. But plaque in your arteries is fat and cholesterol that grows inside our arteries, just like if you pour too much grease down your kitchen sink and then you have to call the plumber to come and clean it out because it clogs up all your pipes. Cholesterol clogs up our pipes. And knowing how high the level is helps alter our diet, which can be high in cholesterol. If we're eating a lot of red meat animal fat, I sort of think of it as fat that's solid at room temperature is harder to metabolize off. So if in the days when we didn't have as much throwing dishes in the dishwasher, but we actually had to wash our own dishes, you know that the fat that melts off of a red meat animal, like a steak, and when it gets cold on your plate, it's really hard to scrub it off. Like you need to use more, scrubbers and soap. But the fat from, say, poultry or chicken or turkey oils and fish oils it stays liquid here on your plate. So the solid, harder to scrub off fat is harder to get metabolized out of our system too. So you want to try to keep red meat to about once a week, maybe the size of a hamburger patty. It's really a change for, I think, the way our populations eat. You want to eat more poultry, more seafood. That's going to be sort of better oils for you. And the other big category that red meat animal fat produces is all the high-fat dairy. So high-fat dairy like cream, butter, cheese is going to come from the red meat animal fat. So again, it's how we think about cutting back. Most of the time we can do just 50% of that portion size instead of buttering like both sides of your sandwich bread. Like you're buttering both slices if you're making a sandwich, maybe we just need to butter one side. Or we just need to reach for half the amount of cheese that we might want to nibble on. Or know that in ice cream, because cream is rich in saturated fat, you want to pick the brand that has less saturated fat in it. So read the nutrition label on the back that says how much saturated fat there is per portion size. And you can often find a brand that might have a bit less in it. So those are maybe some of the big categories. And another really big category is a term called hydrogenated oil. If you look in the ingredient list of the usually like treats that we buy, like Oreo cookies or cookies, pastries, things we buy with our coffee in the morning, commercially baked goods really like using solid fat. If you remember from like 1970s, it would be Crisco. Nowadays, it's hydrogenated palm oil. Palm oil gets solidified from being a liquid into a solid by a process called hydrogenation. And so that adds hydrogen ions to your fat molecules, so it turns into a big molecule, and big molecules are solid at room temperature. So now that solid fat becomes hard for us to metabolize. But nearly all commercially baked goods use that kind of fat. In Europe and non-North American countries, the term is refined. It makes you think you're eating something elegant, but refined or highly refined oils is the same as being hydrogenated oils. So look for that terminology in the ingredient list. I know I don't usually see that in a loaf of bread, but you'll often see it in most treats and things that we buy, like from Costco or just what we buy with our coffees in the morning, but in commercially baked goods. I think when we bake at home and we might use butter, it's probably still a little better than hydrogenated oil that's more artificially thickened. So most plant-based oils are fine. Coconut oil is maybe the only one that's not so, it's not so easy to metabolize. as it's becoming more popular, people are realizing maybe coconut oil is not a good fat. But again, it's solid at room temperature, so it's not hard to think that maybe that's not so good for us either. Do you know also in peanut butter, the kind that separates and you have to stir it is better because it's not hydrogenated. The reason why Jif or Kraft is creamy and smooth and you don't have to stir it is because the peanut oil is hydrogenated. So just look for that in the ingredient list and find a brand that doesn't have it. Triglycerides are another bad fat. I think it's got a little bit less worry than LDL when it's elevated, but triglycerides mainly come from starch, sugars, and alcohol. So that's the cutback product when we're eating. Other risk factors are just the genetics, which we really don't know how to change our parents yet, but maybe in the future we'll have some solutions on that front. And I think in anybody where they learn that they had family members that were affected by their heart disease under sort of the age of about 65 to 70, it's too early for them to have developed heart disease. It takes 10, 15 years to get to the point that somebody needs a bypass or a stent or some intervention. So in the people whose family members start their disease early, it's good to talk to your doctors about, hey, I have early heart disease in my family. How do I know how to identify that in myself early? And how do we change our habits and choose better foods and exercise more if we're seeing that there's clues in our genetics around that. And then one other risk factor is diabetes. Diabetes is a really potent risk factor for developing vascular disease. We consider anybody who has diabetes to pretty much have vascular disease over their lifetime. We choose aggressive goals for lowering their blood pressures and their cholesterols if they are diabetic. Again, we can't feel our blood sugar when it's elevated, so unless somebody's checking it, we don't know. So there is, again, back to that preventative maintenance. Make sure you're seeing somebody who checks on these things so that we can get a heads up that we should be doing things differently with our diets and our exercise. So those are mainly some of the risk factors that I wanted to talk about. And then I think, Mary, we're going to talk a little bit more about just the different kinds of things that happen with the heart and what are some of the solutions for them.
You want to take any questions?
Oh, yeah, if there's any questions, I would happy to take.
What about the passive smoking?
Passive smoking? Yeah, so that's secondhand smoking.
How dangerous it is and
Yeah, for sure.
from friends and
Friends, family, like family members that are smoking in our household, and especially if we're children and we're exposed early, it seems like there is more potent impact to our lung and heart disease over our lifetime. So absolutely, I think if you're smelling smoke, that means that you're inhaling some of the particulate of what is being put out into the atmosphere where we are inhaling it too. We will actually see, say, spouses of smokers also developing bad lung disease even though they can smoke themselves. So there is absolutely a transmission and sharing of that risk if there is secondhand smoke from parents, siblings, and thankfully the days are over where at jobs we aren't sitting next to smokers like we used to in the past. Lots of questions. Go ahead.
Certain time of the day we should measure our blood pressure.
Oh, that's a great question. I think at the for the people that are more project-minded, I would say that as you're trying to learn what your blood pressure behavior is, taking it a couple of times a day can be very helpful. Sometimes that helps you realize that there's ups and downs that are natural in our blood pressure patterns. It also helps you learn maybe what the influences are, like maybe when our work stress is pretty heavy, there might be times when our blood pressure is higher then, and we don't appreciate that may be 8, 10, 12 hours of the day that it's running elevated versus when we're relaxed at home. I wanted to also maybe say that when blood pressures are the highest in the mornings, when we are expecting, that's when we're coming out of a refreshing sleep and it should be at its lowest. It actually speaks to the possibility of something called sleep apnea. Sleep apnea is when our breathing cuts off and stops in the middle of the night and we don't even know that that's happening because we're asleep. Sleep apnea is also a risk factor for developing heart and lung disease. So not just a nuisance to the bed partner who has to hear a person who might be prone to snoring, but snoring is one of the clues around sleep apnea. That's another thing to bring up with the doctor that you're seeing in case that you're picking up on those clues. But learning that the blood pressure might be higher in the morning when it shouldn't be is sort of just the way you educate yourself that your blood pressure might be a clue around risk factors. But when you collect a whole bunch of blood pressure readings, it helps you understand what your average is, and it's probably that average that you're aiming to treat at the end. Jeff, the questions?
Yes, so what about good fats and oil? What about fettuccine, olive oil, ghee? Like, what do you recommend?
Yeah, so I think the thinner the oil, that should be our go-to. So usually plant-based oils are good for us. Olive is known to be a good oil to use. I think that Mediterranean diets that heavily use olive oil are thought to be also risk-reducing diets. So I would avoid even ghee and coconut oil because those to me are like that solid at room temperature, red meat, animal fat type of oil that's harder to metabolize. Go ahead. So I think that the maybe the bigger problem I have of being able to say, eat this, it will lower your blood pressure, is that there's probably not like a lot of really good, abundant trial data, like a really scientifically vigorous trial that looks at how do I see a reduction in risk in people consuming this food versus that food. But I think there's a little bit around beets and garlic as being good for lowering blood pressure, but the effects are usually pretty small. So by the time we've got like some significant high blood pressure that needs help and being treated, those may be little bits that help, but if you need a lot of help, you're probably back to needing some work with a doctor and medications to try to get to the right goal numbers. In the back too.
Since I heard you mentioning about plant-based oils, I wonder if you know much about the chemicals that are produced in heating plant-based oils, similar or the same chemicals that are produced in smoking, and the effect that those might have on the arteries and the development of cardiovascular.
I don't have a lot of knowledgeable background about that, and I bet that has a lot to do with the degree to which the oils are heated as well. Like I bet that changes its composition, and I think the smoke points of the oils that are different can maybe have some impact that way. So I think if you have any further knowledge about that, that can be helpful as well. But it's always good to sort of pay attention to certainly, you know, I think how much we overheat some of the oils, and especially the products that are like deep fried, for example, I think can actually work against us. And of course, that food item is also going to absorb a lot of oils. I think in general, you want to reduce the amounts of fats that are coming into our body, even if they're good fats. So for the person whose metabolism struggles with trying to get rid of this, cutting back is always a good strategy. I'm not sure if I answered your question.
Isn't it more an issue of toxins, though, in
Yeah.
the oil, than an issue of being able to metabolize the food?
Mm-hmm. Yeah, so exactly.
Especially in fried foods.
Yeah, especially in fried foods. I agree. I think Exactly which oils versus which toxins, I'm less knowledgeable about, but welcome any comments on that, or if Samir knows anything more about that.
Actually, I was discussing with my nutritionist once, what you're thinking of rice and she told me like, look at those things too, like she's saying that these are the most, which only have the
Starch.
starch and that, it will not burn.
Yeah, so I think when it comes to anything that's starchy, if the goal is that you want to reduce the amount of sugar that's coming into our body, or the amount of calories that are coming in through starch, or somebody who has high triglycerides that are driven by starch and sugars, then those are the kinds of foods that you would cut back on. So I think of starch as anything that's white mainly, and so it's bread, pasta, rice, potatoes, pastries, of course,
All that is,
everything that people are gonna love, but it should sort of be respected that all digests down to sugar at the point that we absorb it. Like when we're told to cut back on sugar, we're kind of thinking mentally about how many teaspoons we're putting in our tea or our coffee, but all of rice, bread, potatoes, pasta, pastries are dissolving down to sugar molecules at the point that we absorb it into our body. Starch is just sugar that's strung into a bigger molecule called starch. So it's just, that's probably where they're coming from. So I'll let Samir have, any, more questions. Go ahead.
Does it mean that air fried is in general safer than oil fried?
Yeah, so I think if the strategy is to cut back on items where they're gonna soak up a lot of oil and fat, your air fryer option suddenly starts to become more attractive. Yeah. Another.
How often do you recommend to do a test for your heart test to make sure you have
To make sure everything is okay. So I think if nobody has had sort of annual testing as a routine, I would start with that. It starts a conversation with the doctor who orders it, so that there is an opportunity to see what is trending, what's off the normal ranges. There is also, especially around cholesterol, a wide variety of what normal is for people. So I think humanity is probably the most variable when it comes to cholesterol. When it comes to blood pressure and blood sugar, we have much more clearer goals. When it comes to cholesterol, it's a real statistical decision when somebody looks at your cholesterol numbers on paper and says, oh, your cholesterol is high, you should be treated. Or, oh, your cholesterol looks really good, you're probably okay and you probably don't need to be treated. The problem with that in my mind is that you're right most of the time statistically, but for the individual, you can still have low cholesterol for everybody else, but for your body, it's still too high. Or vice versa, that somebody has high cholesterol and for your body, you still have good metabolism or genetics, or maybe something about your system is still able to manage that. And it may not mean that you must have that really high cholesterol treated with drugs, that maybe that person can get away a little bit with their diet and exercise at first. But it needs ongoing monitoring because things change in our bodies as we get older, and our metabolism may not be as robust at taking care of it like we were when we were 20. So it's a moving target, and you can get clues around what's happening inside of our body to validate whether the cholesterol number that we have is actually okay for our body, or maybe even if it looks okay, it's not low enough for our body, by doing certain kinds of tests that we can do through our doctors or even sometimes CAT scans, and even mammograms, will comment on whether there is blood vessel, plaque, cholesterol, calcification, which is a process that happens when plaque has sat there for a little while and it deposits little bits of calcium within it. So there are tests and even clues that we can get from just casual tests we might have had. But if we're paying attention to the comments that the radiologist makes on the tests, we pick up clues about what's happening inside of our body. So these are just conversation pieces that we can have with our doctors.
How can you get your doctor to do one of these tests? Because in my experience, they only want to do blood tests, and there's no actual diagnostic test they can do that will say, oh, you have heart disease, you have blockages, you have blockages, aside from having a heart attack and getting an angiogram.
Yeah, so thanks for asking that. I think that sometimes we have to actually be our own advocates and push with the right questions. And sometimes if we feel that we're kind of wanting to ask a bit more about exactly that we might have to push our doctors to order some of the tests. And you're always welcome to seek one of us out and see what, if we can kind of help catalyze something like that too. But I think that primary doctors also have like short amounts of time to kind of process a lot of things in the little 10, 15 minutes that they get with you. So sometimes it's just a matter of making that appointment specifically to ask for certain questions so you can dedicate some time to that and then just kind of really push them to help you navigate some of those things.
No, I want to reply to this question because usually when you go to the doctor, ask for a complete comprehensive blood test. So with a comprehensive, it covers the cholesterol, all, everything.
Yeah.
And from the reading, you can, the doctor cannot say no to you.
Yeah, I think they can guide you.
Yeah.
And I'm even thinking that sometimes it's good to walk through some of the test results that we all now have more access to from being able to log in to our, charts and reading through some of the radiology test results. And then you can bring that up with your doctor as well. So some of our own sort of legwork can pay off as well.
Swedish is someone that had to put in the running.
Treadmill testing? Yeah.
But sometimes insurance doesn't pay for it, so you
Yeah,
end up
it's-
not having to be able to do it.
It is very much sort of navigating some of those hurdles for us, that's for sure.
I wanna ask, for someone who has high cholesterol, high blood pressure, and some rheumatoid arthritis issues. You take some things for or eat some things that are good for rheumatoid arthritis, but it causes your heart problem. And how do you balance it? More natural things. I'm actually taking 100 milligrams of losartan. It's not doing anything. My high blood pressure is like 170 over 150. So it's not even working. So eating better and exercise, all those things, but it's not going down. What do you do? What
Yeah,
are
so-
natural solutions?
I love that you are starting off saying, I know what my numbers are, because I think that becomes your first step to actually bringing this back to your provider and saying, here's my collection of blood pressures at home. They don't look very good. What's our plan to get them to look better? And then as you kind of work out a plan with them, they can certainly help sort of navigate, are we on the right combination of medications? Is there a reason to be doing additional testing to figure out why the blood pressure has suddenly risen when maybe in the past it was under better control? Working through that list of things that I was mentioning earlier that can raise people's blood pressure is all part of how we would navigate through that. When a doctor adjusts your medication and then sends you home, they're hoping that you've responded. But because you're not seeing them every day, you have to do that in between work to keep a record and show how is that blood pressure trending after the medicine change that just happened. And now that messaging your provider is a little easier, you can send them a message in 2 or 3 weeks after they've changed your dose to say, this doesn't look like it's achieving our goals yet. What's our next step? So I think putting ourselves in charge of circling back to them and, putting them on point as to what can we do next is maybe perhaps part of our responsibility too. But it's definitely a complicated question because it takes a lot of work before you finally hit that autopilot place where everything's working well and we can coast there for a while.
I mean, the question underneath is what is a natural, supplement or they just suggested the red yeast.
For like cholesterol.
Cholesterol, but for high blood pressure, is there any?
Yeah, I think blood pressure probably, I don't have a lot of great here, eat this, you'll see lower blood pressures. I think the only things that I know about are a little more like garlic and beets, but I think it's a really modest, very small improvement, and that's not everybody who reacts that way. DASH diet, which is sort of a way to sort of look at primarily cutting back on salt, I think is the main food ingredient that people have a reaction to in terms of high blood pressure. Do we have till, is this like a second to
We have as much time as you
Ah,
want.
perfect, that's wonderful.
But just so that we can kind of maybe move on to Samir's presentation, then we can always come back.
Yeah, absolutely.
Yep.
So I'll give the floor to Samir.
Thank you, everybody. Yeah, so unfortunately, I'm not as captivating as Mary is, who was able to do her whole talk without any slides and had 25 people asking questions. Her talk was just a lot more about risk factors, right? She talked about blood pressure, she talked about cholesterol. Just to kind of add to it, I think the biggest things for both of those are things that you don't have a way of knowing that there's a problem before there is a problem, right? You don't know whether the blood pressure is elevated, you don't know if your cholesterol is elevated. So the only way to get that figured out is to check it, right? So you have a lab test, you have a blood pressure evaluation, you can do it at home. You can't do lab tests at home, but that's one thing. That's point one. Point two is that this is something which there are many natural ways to affect this. So low salt diet, cholesterol diet, exercise, all of it, that's stage one. Stage two is you see what your baseline is, and like you said, there are certain things that can cause acceleration or to rise significantly, and certain things that cause it to fall significantly in a period of time. So for some people, if they have blockages in some arteries, very quickly their blood pressure may go up without knowing, and medications cannot control it. So those are things that she and I will look for. Is your thyroid elevated? Is there something else going on that is causing this to go? The third point is that we most likely will start with one medication if we're doing medications, go till the maximum amount, and then put on a second one and third one. And there are certain medications that are first line, certain things that are second line, right? So if you have a kid and you go to I have two sons, and so they have school, and they say that we want to do an action plan because they're not up to speed. They will say, let's try this first, and then this second, this third. Similarly, doctors will say, let's try this activity first, then this medication, and this medication, this medication. A lot of times people will come and they'll say, I don't want medication, no, nothing. I want to do medicine only. She and I both know it's not going to do anything, but we'll have you go for 3 months and try your best. And then at that point, then sometimes people are more interested in trying, knowing that they've done the best that they can. For example, my mother-in-law is like that. She's like, I don't want any medicine whatsoever. I will try this, and then I will go from there. But it's okay, let's wait 2 months and then see what we do. So that's kind of the basic things. And if you, the question about my doctor is not prescribing these tests. So in the cardiology community 30, 40 years ago, people used to get annual stress tests, right? They used to be like in our parents' generation, grandparents' generation, annual stress tests. What we found is a lot of times that was causing more testing down the line without actually changing somebody's outcome. So there would be a lot of false positives. The stress test would be abnormal, but the invasive test was normal. And then now you have also done more testing without actually showing it. So nowadays, people are much more along the lines of controlled risk factors and only react to things if there's symptoms, like chest pressure, shortness of breath, all of that when we talk about symptoms. That seemed like, I think just to kind of round out the questions, that was what it was. Any more questions for Dr. Ali? We'll come back to her, but any other things based on what he said? One man took off his glasses and sighed. Okay, so let's move on. So my talk is more going to be based on interventions and surgeries and procedures and those types of things. So as I go through this, we'll talk about different things that you may have had, your family members have had, your friends may have had. And this is not uncommon. She and I both worked at downtown and at Issaquah. And out of the 4 weekends that I am on call at Issaquah, 3 out of 4 weekends, somebody from Middle Eastern, South Asian, African descent comes in with a heart attack. Inevitably. It's like almost like clockwork. So our community is based in a lot here, it's growing here, so heart disease is going to affect you. And not at the older ages as much as even also in the younger ages. So I had people that are coming in their 40s, 50s with heart attacks into hospital, right? So this is the reason why people are here. So let's talk a little bit about what's going on and what's happening. So because we're talking about maps, just wanted to include a few different things from time to time. So this is in the Quran in Surah 26, the day on which property will not avail nor sons except him who comes to Allah with a sound heart. And so this is obviously talking about the spiritual aspect of the heart. But if you think about it, one of the reasons why people have sound hearts is that they're living well in terms of their exercise, their diet, their activity, their speech, their meditation, their prayer, all those things, lower blood pressure, lower cholesterol, all of that. We researched some of that as well. We didn't include that as much today. But it's interesting that the physical heart being strong and the spiritual heart being strong correlate very well together. So next thing is, let's do a little quick anatomy lesson, right? So what is the heart specifically itself? So the heart is just an organ that pumps the blood around. That's literally it. It's not anything more complex than that at a very basic level. So when the blood pumps out of the heart to the body, those are arteries. When blood comes from those organs like your brain, your liver, your kidney, your lungs, your skin, all that back to the heart, those are called veins. So arteries take blood out, veins bring blood back. In the middle, there's some capillaries and other things, but that's in a nutshell what the whole circulatory system is. But in order for blood to move around, that's what it takes. What happens if the hearts didn't move blood around? What would happen to the blood?
Clot.
Yes. So what's amazing about blood is that blood has to keep moving all the time, right? So the heart has to pump every single time in order for that to happen. That blood is one of the few things that has to be in a constant state of motion for there to be smoothness. Unlike everything else, which is a solid organ, blood is. There's another quick question. Does anybody know where blood is made? Where in the body is blood made? In the heart? No. Say that again. In the bones. Anybody knew that? One guy. Buddy knew that. Buddy, I know you. It's like I went orange. I need you to see. So this is how unusual things are inside the body. Right? Things we make here. Things we make here. So second thing.
Hold it up a little bit for the
YouTube
viewers.
For the YouTubers. I did not get my influencer license, so I have to learn that. So this is what the heart is doing, right? Arteries move blood out, veins move blood back in, blood is made in that spot. The other thing that's tough about the heart is that whenever you do an X-ray, what happens? You get a still picture, right? When you do a CAT scan, you get a still picture. But what is the one organ in the body that's always moving? Is the heart. So whenever we talk to our colleagues that are doing brain surgery, lung surgery, this, that, we say, that's easy. Everything stays still. We're moving all the time, right? And so this is one of the unusual things as far as the heart from the outside, you just want to put in perspective. So this is the neighborhood that the heart lives
Just a quick question about, you said, blood is made in the bones, but if it is made, then it must be consumed, right? Otherwise, it is just, we are just adding blood. So,
So blood cells usually make in 120-day cycles. Okay, so every 120 days, usually your blood is kind of remaking itself. Every blood cell usually lasts around that time. So your spleen, which is sitting on the left side, can sometimes sequester that. And the breakdown of those products are often filtered by the kidneys, or they go back into to make new blood cells and things like that. So it's always filtering, recapturing, remaking, so blood is continually made. This is why you can donate blood, and you're not just, sleeping for the rest of the year. Your body will make blood. So parts of the heart, right? So we talked about blood leaving the heart and what's happening in the heart itself. The organs send blood to the veins, which go to the right side of the heart. The right side of the heart sends blood to the lungs. Lungs goes to the left side of the heart, and then that goes to the body. So blood without oxygen, that's all picking up all the carbon dioxide, comes to the right side, sends to the lungs, which drops off the carbon dioxide, you breathe it out, oxygen comes back in, and then it goes to the left side of the heart, then it goes to the body. And it's just one continuous cycle, right? One continuous cycle. So, other things about the heart itself, some quick facts, we did them as well. It's the only part of the body that is actively moving all the time, right? Everything else is, if you decide I want to be absolutely still, and you freeze. Little kids say freeze in the playground. But the one part of the body is not freezing is the heart itself, doing the same way. Second, there are no bones in the heart itself, but it is protected by all the different bones around, right? Your brain is protected by the skull, this is protected by the rib cage, and the lungs around it, and the spine behind it. So it's a very important aspect for it. Third thing, which is there, is that the heart has its own nervous system. It can operate independently of the brain when needed. How do we know that? Because when they did heart transplants and they moved one heart and put it into another, they could put all the veins together, the arteries together, but they cannot make the nerves go back together. That's why people, when they're paralyzed, it's very hard for the nerve function to come back. So similarly, the heart has its own nervous system that allows it to beat independent of the brain. It's its own independent system that making that. Other thing about it, these are all amazing things about it. One of the tough things about it is that it doesn't regenerate. Your skin, if you cut it, heals, it can grow new skin. Your liver, for people that are drinking alcohol, their liver will get consumed and then go back again. But the heart, once it has a heart attack, those blood cells do not come back. So those muscle cells do not come back. That heart is damaged and it stops moving, that portion of the heart. So it's very unusual in some aspects of the heart compared to anything else. And it beats 100,000 times a day. So that's all just kind of introduction, but inside the heart, and we'll talk about the different disease states, but there are chambers. So people talk about the atrium, the top chambers, and the ventricles, the bottom. The valves, which are like doors, they open, they close. There's the nervous system of the heart that creates the heart rhythm. So that causes it to squeeze with every electrical signal. It sends a small piece of electricity through the heart that causes the top and the bottom to squeeze. And the last is that if something is beating 100,000 times a day, it cannot get nutrition to itself from that beating that's going through the heart. So there are small blood vessels on top of the heart called the arteries and the veins that supply blood flow to that hard-working muscle itself. Okay? So we're talking about the chambers, the valves, the rhythm, and these arteries. So that's the main thing. Any questions so far on any of this? Everybody is sleeping. So areas we will cover, right? So Dr. Lee talked about some of these things, but let's go down into the detail about it. So we'll talk 3-4 different areas: coronary disease, valve disease, heart rhythm issues, congestive heart failure. Next thing, How many people know about heart artery blockages? How many people have heard of this? You know somebody that has a heart artery blockage, right? And what was that like? What do you know about a heart artery blockage?
My father had that, so the flow of blood to the heart was less, and they did they were trying to do a bypass so that the blood will start coming back again.
Okay, so sorry to hear that. He was saying his brother had a blockage.
My father.
Father had a blockage, and they were talking about doing a bypass to get that flow back. So what does this mean? Remember I said the heart, this is the outside of the heart. It has arteries on it. So those arteries can usually have to be smooth for the blood to flow through them. But a blockage can build up inside of that. That can be a sudden blockage, which is sudden chest pressure, wake up in the middle of the night, or it's not getting better, you have to rush to the hospital. We'll talk about what happens there. Or it can be chronic. And you can walk 3-4 blocks, and then I have chest pressure, I have to stop. That is a chronic blockage that is happening over time. Other terms for this that you'll see the doctor say, atherosclerosis, plaque buildup, thrombosis, there's a clot. So you can have chronic buildup over time or a quick buildup. So what does this look like on the inside? And forget the rest of this picture, except for these 4 circles. So look at that top circle up there. There's just a small amount of plaque that's built up on it. Slowly that will grow and grow. And then what will happen is that the plaque will burst. And when the plaque bursts, that abnormality of the plaque bursting, the blood cells attack it and form a clot, and that clogs up the whole artery. And then now the heart itself doesn't get blood flow from that one region, and then that is called a heart attack. Okay? So that's what happens. We have a question. Yeah, so how do you reverse it? So the thing is, you have to get the blood flow, if it's sudden, back immediately in. And that's when we can do an angiogram to go in and then either suck out the clot or put in a stent to open up that. And that's one of the ways around it. So the 2 main ways are something called bypass surgery, where you're not taking the blockage out in any way, all you're doing is bypassing it. So these arteries here are bypassing this blockage. Or you can come in and open up that blockage and put in a stent, right? Those are the 2 main ways that when somebody has artery blockage that you can treat. So how do we figure out if there's a blockage? You're telling your doctor, I have chest pressure, I have shortness of breath. It is after this much, it is not getting better. Then your doctor may say, thank you for letting me know. We want to do a stress test. There are a few types of stress tests. Some you run on a treadmill, so you bring gym shoes. But what if people cannot run? Then they have lying down stress tests where they inject something to put a little bit of stress on your heart and sees whether that causes any issue. If the stress test is abnormal, then we can do something called a heart catheterization. It's a small procedure. We come through the wrist or the leg, go in with a small straw and inject dye down the arteries, figure if there's a blockage. That procedure takes 10 minutes. The risk of the procedure is less than 1%. So once you find a blockage, what can you do? Do you always have to do stent or bypass? The answer is no. If it is sudden and it is, if it is not getting better, you have to open up the artery, fine, we will do that. But if it is chronic, there are medications that they can give you. So one of them most often is aspirin. Another one is a statin, which is a cholesterol medicine. They may also give you something called nitroglycerin, Endure, those types of medications to try to relax that vessel to open it up a little bit. Also stents, bypass. Okay? So in a nutshell, this is what we roughly do with artery blockages. There's a lot more things behind it. But any questions on any of this?
What's the common age that this can happen?
Yeah. It's a mix of genetic factors, diet, exercise, all of it. So we have seen as young as 20. We have seen as old as 9,500. Okay? So there's no common age. When something is the number one killer, it's like saying, when does it kill? It kills usually as we get older, right? We're not seeing people in their 20s usually having it. but sometimes it can. So especially with our genetic makeup, with our diets, with our lifestyles, we're more predisposed to that.
So what's the common, how can you identify that these things are happening?
So symptoms is one aspect, but more important than that, we control the risk factors. And so those risk factors control the blood pressure, cholesterol, other control can either stop this from happening or stop this from being as bad as it could be. Sometimes people say, I did everything, I still have this. And the answer is it could have been a lot worse. You stopped it from getting to that. Good question.
Is it true that, like a genetic factor could be the actual size of those arteries that maybe in like the South Asian population is an actual smaller artery? And so it's more likely to get blocked, especially with the, like our modern
100%,
diet.
yeah.
That's true.
South Asians have usually very small arteries. Diabetes also makes the arteries very small, so some people can develop diabetes, which also affects the heart significantly, and the kidneys and the brain. Every artery is made small. So those things are, yes.
You determine whether to do a balloon dilation
Depends where how acute the situation is, meaning how quick this is happening.
So for YouTube, could you repeat?
Yeah, the question is, how can you determine whether to do a balloon dilation or a bypass, right? Or a stent, balloon or dilation? It depends. If it is in a large enough vessel, we'll most likely stent it. If it is very small vessel, most likely we'll balloon dilate it. So it depends on the size, the location, where it is, and how much blood, how much of the heart muscle is affected by this, that we will decide what direction to go. Sometimes we will just go in, take the pictures, and then do the actual stenting procedure right there. Sometimes we will go in, take the pictures, and then come off the table and have a conversation. We think we want to discuss stenting or bypass surgery and have a discussion with the patient, and then come back. So those things are all new.
I have a doctor tell me aspirin is good.
So yes, and so aspirin can help when people have known heart disease of some sort, right? So you have a known blockage, or you have artery calcification that you found on one of the other tests, like X-ray, this, that, CT scan, whatever. But taking aspirin without any risk, without any known artery blockages, is not known to be helpful. They switch the determination. Sorry? Diabetic taking aspirin, unless you have known artery blockages in anywhere in your body, taking the aspirin itself is not known to be helpful, because the other thing aspirin does is thin down the blood, and it also affects the stomach lining. So it can increase the risk of ulcers. So we always balance that. What's the benefit of risk?
Just a question. Will you be talking about conditioning the heart? How do you improve the?
With shampoo. Yes. So the main thing with conditioning the heart itself is we have something called cardiac rehab. So this is exercise can be used to condition. So the first thing is when you're doing exercise, you like exercise. Oh, I walk. Yes, everybody walks. We know this, but it has to be a certain type of exercise where you walk 30 minutes at a time, or around 30 minutes, whatever it is. 4 or 5 times a week. It has to be at least 3 to 5 times a week. And then the second thing is you have to get your heart rate up to a certain amount.
That's my question about, I thought maybe it's premature since you're touching that. So in those 5 heart zones, heartbeat zones, which ones are good for conditioning the heart or sustained the workout? Which ones are good for burning the fat?
Yeah, so the conditioning of the heart happens even as quickly as zone 2, right? Burning the fat and other things, a lot of times it's more in the higher zones, but if you even keep zone 2 going for 30 minutes and do it on a regular basis, that itself has significant effects on this. Okay? I'm going to move on to the next thing.
Zone 2 is 60%,
Zone 2. What do you want to say?
65 is 1.
Zone 218 ppm plus goes up to
It's,
139.
it's like 55% of your normal age,
Yeah.
and then 60%
So
of your normal.
you're 220 minus age, right? And then from there, then you take a certain percentage. You have one other question. And so this is just any fitness aerobic exercise. So walking, running, there's other things that keep your heart rate elevated for a certain period. Okay, next question. How many people know about heart valve disease? Anybody know about a heart valve issue, a heart valve disease? Right? So what do you know? What happened? Yeah, but what was the issue with the heart valve? Anybody know?
My grandmother's heart valve was weakened and was letting blood go the other way.
Yeah.
But she was so old that, nothing was recommended
Other than just medicine or something.
Yeah.
So, big things is that the heart has 4 valves, and they're like a door. So doors open and they close. So they fail because it's either not opening well, so there's something called stenosis, or it's not closing well, and that's something called regurgitation, becomes leaking. Both are problems, right? Because if it's not opening well, blood can't move forward. Remember, it has to go from the left side to the rest of the body, the right side to the lungs. Or it's leaking, meaning it's backing up, and that's causing pressure buildup. Like if all of us need to leave this room, but that door is not opening well, it's going to be a big problem, right? But if every time we go out that door, we keep falling back in, it's also a problem. So the door has to be able to open correctly and close correctly. And the best way to evaluate this is your doctor listens to the chest, hears a murmur, and that murmur is because, so every time I make this question, somebody leaves. But, anyway, you hear a murmur, and that's because blood is going through a narrow orifice. So normally when your heart is beating and the blood is going, it doesn't create any big sound, it creates a small sound, lump, 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 lump. But when there is a blockage and the blood has to go through something that's tight, it's just like as if you're whistling. The blood comes out and creates a sound, just like air makes a whistle, blood makes a murmur. So similarly, we listen to that murmur and we say there's some valve that's not opening well, or a valve that's not closing well, let's figure out how to fix it. So that we do an echocardiogram. So that's where they put the gel on the chest, they put an ultrasound probe, that's the echocardiogram, looking at the function of the heart, we're looking at the valves. So with that, a valve can be tight, so there's something called aortic stenosis. And this thing is a big deal. So they have shortness of breath, they have leg swelling, sometimes chest pressure, pass out, and 50% of people pass away within 2 years. So it's a big deal. But what happens is that just like we can put in a stent, we can also put a valve inside that same valve without having to do open surgery. So this is just one of the new things that are out there in the past 20 years. And this is 45 minutes and go home same day. I mentioned a leaky heart valve. So this is a mitral valve, and instead of closing well, it's not closing, the blood is backing up. Those 3 arrows, the blood is backing up. So this causes more pressure to go back to the lungs, it's causing shortness of breath. And this, we can repair the valve through open surgery or from the leg, and so this improves the quality as well as the quantity of blood. So we talked about artery blockages and how we treat them with bypass and stents. We talked about valves and repairing and replacing them, sometimes open surgery, sometimes with the leg. This woman in the back has a question. This is my wife.
Can you share what it means to go to the leg?
Oh yeah, so going through the leg does not mean the toe, does not mean the knee. So all these arteries that are coming down here in the veins, inside right above the hip, there is something called the femoral artery and femoral vein. And for us that are doing procedures, we can come through a small incision, maybe about 2, 3, 4 millimeters, and then go and do these valve replacements, valve repairs, sometimes these stents and these other things.
Sometimes you take a vein, I guess, from a part of your body and replace it.
Yeah.
Or sometimes you graft it.
Exactly. So remember we talked about
From an animal?
Yeah. No. So this bypasses, right? They have to get this bypass from somewhere. It's a tube. So they take an extra vein from the leg and they put this here as a bypass. That's what that means by bypass graft. They take a vein and they do that.
But I've heard of grafting it like from an animal.
Usually not from an animal. It's either a prosthetic material, like it's a graft that is made not from an animal, or they do this. Now, heart valves we often use animal products. So we can use a cow product or other animal product or a pig product.
What is the classification of lung?
Yeah, so this valve that we talked about here, aortic stenosis, so in order, as it becomes, it has to open and close, just like the heart beats 100,000 times a day, it has to open and close 100,000 times. As it gets calcium that builds on it, it gets stiffer and stiffer and stiffer, and then it's like, okay. Next one, heart rhythm issues. Oh, go ahead.
Enlargement of,
Coming.
oh,
Coming. She wants to get to the end. Heart rhythm issues, right? So in one very quick thing, we talked about valves having a problem opening or problem closing. For a heart rhythm issue, how do people check if somebody has a heart rhythm issue? How do we check that?
Smartwatch.
Smartwatch as well. What do we do in the doctor office?
let's just go.
I heard it back. Who said it? EKG, right? They put all the things on the chest and then the little squiggly lines come, right? So that's called, that's electrocardiogram. Electrocardiogram, you're looking at the heart rhythm, which is looking at the electrical impulse, which is the nervous system function of the heart. So it can go well. Usually it's every time it beats 60 to 100 times a minute, that's normal at rest. But sometimes it's very slow, sometimes it's very fast. That's really all it is. And you can either do an electrocardiogram or a heart monitor. And then if it is too slow, we can sometimes do a pacemaker to increase it. All people have known of somebody with a pacemaker. Right? Or if it is too fast, we can give medications to slow it down. Or if it is dangerously fast that people pass out, then that's something we put in a defibrillator that can jolt and restart the heart so that it goes back into normal. Okay? So these are heart rhythm issues. These yellow things inside the blue, it's not like the heart changed its team jersey to be against the Seahawks or anything. All it did is just showing that the blue is just the muscle inside. The yellow is just showing where these electrical signals are going. And normally, they go from the top left picture, from the top left to the middle and then down to the bottom. But then if there's a problem, they can go like over here in the bottom and they're short circuited. They're going really fast. And that's causing the tachycardia, which is instead of this typical heartbeat, beep, 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 and that's the too fast heartbeat.
But missing the heartbeat sometimes.
So then either you can miss the heartbeat or it can become too slow. And so then Dr. Lee will get the call and then she'll say, we have to go put in a pacemaker. And so then colleagues will end up putting in a pacemaker. So what is a pacemaker? A pacemaker is a small incision we put in the top left of the chest. And then put these small electrical leads to stimulate the heart here. And that keeps the heart rhythm to keep it. Anybody have questions about pacemakers?
Someone die from arrhythmia?
Yes, they can. And that's why we put in these, if the heart is too slow, then your brain doesn't get blood, the rest of your body doesn't get blood, you'll pass out. If the heart is too fast, then remember the heart has to relax to fill up with blood so it can squeeze it out. If it doesn't relax enough because it's going too fast, again, the rest of the body doesn't get blood. It has to live in a medium.
When you say too slow, how much slow?
So 40s, 30s, yeah. But sometimes you have athletes that can be very athletic, but pulse will be very low. How is that? Because the heart has figured out how to squeeze much more because they conditioned it.
Are there known causes of these rhythm irregularities?
So some of these can be genetic. Some of these can be due to medications. Sometimes we prescribe metoprolol, this, that, whatever, when the heart becomes too slow. Sometimes it's due to issues in terms of other events, such as artery blockages. Sometimes it's the heart muscle itself that has a scar or some problem, and then it's going
So, metoprolol, that's used for blood pressure?
And it it also slows the heart rate
And
down.
so somebody might be prescribed metoprolol for a different cardiovascular issue, and that could end up causing irregularities?
But when it does, it slows the heart rate down, it should not slow it down to a dangerous level. So when we go to, so sometimes the medication prescribed for blood pressure, they do other things, like losartan also works on the kidneys. And metoprolol also works on blood pressure and also on heart rate. So there's a movement. It's not necessarily side effect, sometimes it's a benefit. Because if the heart is pumping really hard and really fast, it also increases blood pressure. So you're affecting blood pressure through different routes. Like losartan works on the kidney component, metoprolol works on some heart component, and amlodipine works on the blood vessel component.
So if you're taking those medications, you should be
Aware, you should be aware of these things, but your doctor should be looking at it. And so, and each of these has certain side effects that are more common that they can ask you about and say, are you having this issue or that issue? Based on those things. One last portion was your question, looking at congestive heart failure, right? So what happens if the heart is too large or it's too thick? So blood has to move from one chamber to the next. If either the heart can't fill because it is too stiff, or the heart is too relaxed and too lazy and it's not squeezing as hard as it should. I think this is my wife describing me. But anyway, we're going on from there. These are the two main issues that lead to something called congestive heart failure. Anybody here that's CHF? Right? So it's either because the heart is not pumping blood out because it's either too stiff or it is too relaxed. And this is where we usually can see people prescribing multiple medications to, especially when the heart is weak, to try to get it stronger. So they'll prescribe either metoprolol medication, they may prescribe spironolactone medication, they may prescribe canagliflozin, these medications, and then they'll prescribe entresto as well. So you'll see all of a sudden we went from having no medications to having 3, 4, 5 medications all at one time. And it's very hard because we don't always take these off, but these can help the heart to squeeze better and get back to a normal squeeze level so that it gives you more strength and energy. Sometimes these don't work as well as they should. And then we start thinking about, there are some people who are so sick they require even more. And those people may get a assist device that also causes some external pump on the heart, or they may even get a heart transplant. So that's roughly how this whole thing works in terms of the CHF. Start with meds, get the heart to get better. 95% of the time it's stabilized or it's treated that way. 4 or 5% of the time you start thinking about these other things. So rarely. Okay. So in a nutshell, that's it, right? We went through the arteries, we went through the valves, we went through the rhythm issues, we went through heart failure issues.
You said
Thank you.
enlargement?
Because that heart can get larger and not squeeze as well as it should.
Does it have an effect on low blood pressure, high blood pressure? we're talking
Yeah,
about?
so low blood pressure can also happen as a side effect of some of these meds, and sometimes, or is because the heart is so sick it doesn't squeeze enough to create enough blood pressure. That can also happen. So somebody has a big heart attack, their artery is blocked, the heart is not squeezing, their blood pressure is low. That can also happen in the very quick setting. That doesn't mean every low blood pressure is a big heart attack. Sometimes it's just because of medication, sometimes it's because you're dehydrated, few of these things.
You say blood was circulating and getting back to the heart. What if the vein become plagued or weak or?
If the vein becomes weak, yeah. So the question is, if blood has to go back to the heart, we talked about the heart for a long time. What about these arteries and veins? Can they have problems? Great question. The answer is yes. And it's our job to figure out whether the heart's the issue or these arteries or veins and the rest of the body is an issue.
That's the next way to where the heart goes, the brain goes.
Just, I just, sorry.
No, you're first time you said it.
I just have a question. Does the weather play a role, like here we are in Washington in the West, where the weather is cold? Where I came from Zambia, I came from Egypt, where the weather and the Middle East usually the weather is hot when we just have a normal walk in the evening, we also drink a lot of water, we sweat more. Like I have heard that with the cold weather, it tend to make the vein shrink. And this lead to more high blood pressure, higher than in hot countries.
Yeah, so the question is, how does weather affect the heart? I think weather can, also diet, exercise, all these other things. You mentioned that you're hydrating more. You can still hydrate even in Washington State. So you can work around it. That being said, there are 2-3 big times where weather does play an impact. One is in those places where it snows. When people start shoveling, they're inactive for a long time, and then one day they just wake up and decide to shovel big heavy snow. Heart attacks usually go up that time right after snow. The second time is right around the time change. The stress is so high when the time change happens in the spring that usually heart attacks go up, heart issues go up. It's a known issue. Because you all of a sudden lose 1 hour of sleep, and then everybody has to get up much earlier, they have to go to work earlier, so that time change issue in the thing also causes some issue in terms of heart disease across the country.
Wow. I can sleep 1 hour early.
You should be in charge.
No, I mean, sometimes you get 5 hours of sleep, sometimes you get 8 hours of sleep. And
Yeah, you have to plan, but not everybody's planning. Other questions?
We heard about the risk factors, we heard about the issues, but now I'm a bit not clear yet about how we connect between the risk factors and the issues here. So, well, for the blood test, it is pretty clear, right? For example, cholesterol, there is cholesterol plaque, and that causes the problem. But how about the other issues, for example, protein and the others? What is actually causing this? How we can, for example, reduce the risk from, let's say, making our lifestyle better? I'm a little lost in the connection of this.
Oh, that's a really good question. I think, the question was, we talked about risk factors that affect our arteries and how the things that I was talking about, essentially, blood pressure, cholesterol, diabetes, genetics, smoking, even sleep apnea, as being a feeder of blood vessel disease. And what about rhythm disturbances? What about valve disease? Those are less perhaps connected to the risk factors that I was actually talking about. And maybe I was focusing on the risk factors mainly because blood vessel disease of cholesterol gumming up our arteries is actually the most common type of heart disease. It's what I think as a human being we're all going to face to some degree, just different gradations of it as we get older. Valve disease, rhythm disturbances are just a little less common and perhaps also a little less dependent on some of these risk factors. Having said that, rhythm disturbances, for example, can also be influenced by some of these other external factors. I'll give you an example. If somebody is overdoing the caffeine intake, maybe they get a job where they have soda nearby or a coffee machine nearby, and now that's all we're doing is sipping caffeinated beverages. Before you know it, our body starts to have a reaction as our caffeine level increases in our body, and that stimulant effect can be a trigger for that rhythm to start beating faster. So if we have an already tendency of developing a fast heartbeat pattern, it's going to become aggravated by those external factors that are going to make our heart beat faster. Other things that make our heart beat faster might be some of the decongestants that we use for allergies or cold remedies. It'll actually say so right on the labeling of the product. Beware, it can cause fast heartbeats or high blood pressure. Or if we're overusing asthma medications, that also makes the heart beat a little faster, you can trigger rhythm disturbances. So we may have, things that aggravate our, faster type of heartbeat tendencies. Valve disease, I think, has a little bit less in terms of direct things that we do. I think the degenerative process of the valves either becoming leaky or narrow probably have a little bit more to do with aging, and it probably has more to do with some of the younger populations having things that they were either born with, or sometimes we acquire infections that can degenerate the valves even in our younger years, and then that leads to needing valve work done, replacement or repair.
How much too hard or too lax?
In terms of the heart muscle,
So, yeah, the heart muscle.
so there's, so the terminology of congestive heart failure is such a, it strikes fear in everybody's heart. When you hear somebody has heart failure, it sounds like you're gonna be dead in an hour. But actually, there's a whole list of things that lose the heart of its efficiency. And I think that's probably what that term really means, is that your heart's losing efficiency and its output is dropping because of that loss of efficiency. And you can imagine all the different things that we talked about are contributors to a certain efficiency that the heart has. So if, say, the valves are not working in a sense that maybe one is leaky, that leakage makes that heart muscle have to work harder. It's having to pump the blood that's coming into the chamber, but then if it's leaking, the backwash is an additional bit of volume of blood that pumping chamber is also having to eject. So with every heartbeat, that poor muscle is ejecting an extra amount of volume. That will cause that muscle to have to enlarge because it's holding more blood volume. And that with every single heartbeat, as that heart muscle enlarges, it's going to create a reason for it to get enlarged and dilate, and then that loses efficiency. So when your output drops because of that, now you have a problem where your heart's not pumping out the right amount for your body, and it leads to heart failure.
But is there any particular, like a risk factor or lifestyle issue that causes?
So it all depends on what is actually creating that loss of efficiency. So valve disease would be one. If you damage the heart muscle because you've blocked an artery off and it's created damaged muscle, then you've lost a certain amount of squeeze from that heart, and that loses the heart's efficiency from it being enlarged or being, scarred down. And then it goes back now to the risk factors that created the blockage of the artery. So each different reason why that muscle isn't performing properly is going to be the contributor of that heart failure, and then that reason will have its own risk factors. I don't know if I answered that right.
Sorry, Victor. I just wanted to say that usually we have the 8:45 mark, but we can continue to take questions, and there's a few more left, depending on our presenter's time. But I noticed some people were leaving, so I just wanted to give you a chance to thank our presenters today, Dr. Humaira Ali and Dr. Samira Ghafour. If you can give them a round of applause. Thank you all for taking time. I know both of you just came back and you probably have shifts on the weekend and you're probably helping people all the time. And so I appreciate how busy your schedules are. So thank you for taking the time for our community and your own community, of course. And we're always, looking for more people to present to the community. So if you have expertise, you have skills you want to show, then please reach out, inshallah. And Sister Malak and I will, inshallah, work with you on that, inshallah. Inshallah, we continue. A few more questions, inshallah. We can wrap up around 9 o'clock.
Oh, just to continue a little bit about, thanks for reminding me, like, just, ways in which to manage somebody's, heart failure. Say they already have heart failure, and now we're like, you know, how do you manage that person's sort of ability to, control, their loss of efficiency that their hearts, cause them. So one of the things is, a person who's got a weakened heart muscle becomes even more dependent on having good blood pressure control, because a weakened heart muscle that has to pump against a high blood pressure, it acts against its efficiency. So it's gonna actually work better if you have a lower blood pressure for that muscle that's struggling. So that person who might have high blood pressure it'll be even more important for them to control their salt intake, for example. So, and then if their loss of efficiency is causing a certain buildup of fluid in their body because their heart's just not able to pump it forward as well as it should, may have to control how much fluid they're taking into their body. So they're often given like a bit of a fluid restriction. You can only drink this much as an ideal amount for what your body's able to handle. So that becomes part of the management of somebody who might be struggling with a heart failure syndrome.
Room for one or two more questions.
Oh yeah, for sure.
If somebody has a heart attack and taken to the hospital, or there is no medical services and you don't have aspirin to give, so what's at that time somebody can help?
This is a circumstance where you cannot bring them to a hospital and they're having what you worry is a heart attack.
Yeah.
Yeah, I hope we're never in such a circumstance. We're lucky that we live in an environment where there's easy 911 calls and you can like bring somebody in, because that really does mean that there's a mechanical blockage, right, in the artery that's delivering blood to the heart muscle for the work it has to do. And it really at that point needs that solution of dissolving the blood clot that's in there, which is what aspirin helps with. But then you need the services of an expert like Dr. Lafouche to go in and open that artery up with the balloon and the stent. So we become extremely limited how we can help somebody who's in the throes of having that happen. I think at that point, you're still trying to get them to the care that they need as soon as possible. What was the particular circumstance that you're worrying about?
My dad died because of this. So.
Oh, that's too bad. Were they in a rural setting?
In Pakistan, so at that time you don't have any service.
Yeah, it gets really difficult, and unfortunately, those are the scenarios where people don't do very well. Yeah. Sorry, I'll just say that.
What are the risk factors in women?
What are the risk factors in women? That's a good question. I think they are generally the same risk factors that I talked about. There are some unique things about women in terms of how they perceive the symptoms that they have. It's been recognized that the really typical chest pain type of patterns that we more often hear when they're when there's a patient who's not getting enough blood flow delivery to their heart muscle, for example, and they're just in that preliminary stage of in the near future they're going to have a heart attack. Usually we're looking out for somebody who describes chest pains, but in women, for example, they may have more of a feeling of shortness of breath, or a little bit more vague in terms of recognizing that something isn't feeling right. They may have like a lot more of a fatigue, shortness of breath, declined exercise tolerance. I used to be able to do this before, but now I'm struggling and it's taking me longer and I'm having to slow my pace and take more breaks, but without the really typical symptoms or syndrome of a chest pain that's outright. So we're sort of always trying to recognize how somebody's describing their symptoms And I think anybody who feels that something is different about their usual abilities to do things, it's always worth paying attention and discussing that with your doctor, because sometimes it can be more subtle. And just kind of listening to the patient describing that something is different about how they're feeling is often just worthwhile investigating a little bit.
Sorry, one big thing about for women is that, a few big things is in pregnancy, it's almost like its own stress test for women. And so sometimes they'll have valve disease or heart issues that were never recognized before and that only come to light during pregnancy. So that's one thing to be aware of, especially in other countries, they may have big valve issues that don't come to light until that point. Secondly, also in pregnancy, blood pressure can also go up dangerously, and that can go down after pregnancy, but those people are more at risk for artery blockages later on. We're finding that out. Third one is that usually women have better cholesterol numbers than men. That high, happy HDL cholesterol is more often higher in women, but that changes sometimes after menopause. So that's something to just know around these times of pregnancy and menopause, as well as other things. Those are key points on it. The other big thing for women is that they will often come in later than men in the middle of a heart attack. If a man has a heart attack, he'll have typical symptoms. He'll come in sooner, he'll be recognized sooner by the ER, and he'll get treatment sooner. Women will wait longer to come in, they'll get recognized later and be treated later. Because of some things that they may not have the same symptoms as men. All the books say this pain in the left arm, jaw pain, all that is more male symptoms. Women sometimes it's just some pressure, some shortness of breath, sometimes something unusual. But the other thing is, because a lot of times women are taking care of their families, they will put off coming in, right? And this is a known issue. So these are things to just be aware of, to not minimize that, because the heart muscle cannot regenerate. It has to, once it's gone, it's gone.
That's fantastic, thanks for that.
What are the other symptoms of feeling like you're having a heart attack? It's like pinching or poking?
Oh, that's a great question. So I think in general, the things that maybe my alarm bells go off when I hear somebody talking about them is more of that pattern of there's something that's making my ability to do my usual job of, housework, yard work, stairs in my home, the incline to the mailbox, the things that we should have built up efficiencies doing, like it shouldn't feel harder to do something we do every day. But if we recognize that we're struggling more with our breath or we're developing outright discomforts, whether it's tightness, pressure, heaviness, or just pain, and usually it's an all over feeling. It's that oppressive kind of feeling in our chest when we're trying to do something. Those are maybe where my alarm bells go off. The types of pains that are just there for a second or two, fleeting, there and gone, and you can really point to where it hurts. It's like localized. It's right here. Those tend not to be the heart. The heart tends to be kind of an all over type of a feeling. And when people describe what they're feeling, they'll usually use their hand or like a fist to say, that's where I feel it. When you start using a finger, it's really localized. The farther out to the sides it is, I'm less worried that that's a heart symptom. Yeah, and especially if you push and it's tender, then it tends to be more like muscle or bone. Usually heart is not going to be tender to touch, just from the outside. Oh, go ahead.
Is it true that sitting is worse for women than men? Too much sitting?
Oh, I don't know about women. I think it's probably tough on both
This
sides.
is a dangerous question.
Yeah.
No comment, we're not answering this question.
So, along the exercise side, I'm just going to get you in a second. The exercise, I was thinking I was going to jump in when we were talking about that, but there's some recent reports that even for the person who's the couch potato, even 5 minutes of activity a day, that's like a walk up the stairs, has measurable benefit in outcome benefit in people. So the bottom line for exercise is that any is better than none. And even 5 minutes is something versus nothing. And that the weekend warriors, where you pile up your exercise routines for the weekend because the weekdays are too hard to do them in, even that has benefit. But if you said, I'm a couch potato, what's the minimum amount I should be doing? It's usually about a 30 to 40 minute brisk walk equivalent in a day. Now, it doesn't have to be a brisk walk. It could be a swim, or it could be a rowing machine, or an elliptical, or a walk in the mall. But something where you just elevate the heart rate a little bit and you sustain it. And the other interesting thing is that you can do two 20-minute walks and it'll be the same benefit as a 40-minute walk. So you can even divide this up and still reap some benefit out of it.
A related question. Are you finished with it?
Yeah, go
Okay,
ahead.
so is cardio exercise preferable than stress exercises, like weights and all that?
So generally, the aerobic exercises benefit the cardiovascular system more than the weightlifting type of exercises. Sorry, I meant to get your question.
I'm sorry to go off of the exercise stuff, but I was curious, for somebody that might have a family history of rhythm irregularities, are there like diagnostics that can help them to be more aware of what, of their own risk of developing that, or things they can do that may be prevented, or do you think they should do?
Yeah, absolutely, I can let you answer that.
Yeah, so things about honestly, I don't know whether it's something different for men and women, so that's one aspect that could be there right now. On your thing about, you were asking about exercise and just, weight is also important, don't minimize it, because as we get older, we will fall, we will have problems picking things up, picking up children, picking up weight, groceries, all of it. The more you do now, it will help you in the next 10 years, 20 years. For women, osteoporosis, the more weight resistance they do, the stronger the bones will be. Your question about rhythm issues. There are some rhythm issues that happen in less than 40, less than 50 years of age, which can be familial, and there can be genetic tests to figure that out. There's some things that are big genetic diseases that can cause people to pass away suddenly. So sometimes we'll ask, did anybody in your family pass away suddenly, or pass out suddenly at a young age? And those things are triggers for us to say, oh, we need to check for other inheritable rhythm diseases. But if somebody had a pacemaker in their 60s, 70s, 80s, or defibrillator in 60s, 70s, 80s, that is less likely to be familial. More likely this is something as we get older, the rhythm system gave out. That is a general rule of thumb.
Blood donation and cholesterol has any relationship?
Yeah, giving blood is not going to lower the cholesterol. Because cholesterol is balanced all throughout the whole blood system. So I think giving some of it away is like, having 3 children, giving away 1, you're still a parent. Yeah, so smartwatches, so our smartwatches helping. So in the beginning when smartwatches came out, they used to say like, oh, we're going to acknowledge that you can get a rhythm issue we can pick it up very easily. But smartwatches are only as good as the rhythm detection technology. Now as AI has gotten better, that has also gotten better. But you can still have more false positives. So always this should be adjudicated by a doctor that's also looking at it saying, yes, this is real or not real. There are times when it has picked up abnormal heart rhythms before we can, but it still needs to be brought up in that same context. I can trick any one of these to saying this is an abnormal rhythm by just moving it at a certain speed. Sometimes it has seemed that looks like it's a dangerous rhythm, and all it is the person brushing their teeth. So these are known things that we've seen as well.
No, actually, my question was like, is it not helping reducing these heart diseases because of
Yeah, rhythm is just one aspect. Yeah, rhythm is one aspect. So it helps in the sense that it monitors it, but it is also sometimes increasing the amount of disease, but it could be a very small component that would not even picked up anyway. So we don't know yet whether it is improving or not. They want to think it is because they'll sell more watches, but it is not something that is proven yet. Okay, we'll end with that, inshallah. Subhanallah wa bihamdihi, ashhadu an la ilaha illa anta, astaghfiruka wa atubu ilayk. Assalamu alaikum.
You first and right when I stop by the airport, I'll type it out.